30-year-old lady who lost her missing upper right central incisor many years ago due to an accident came in asking for an implant to replace her denture. A CT scan was done to ensure that the bone can support the implant, and this is the final result.
Patients as young as teenagers who have a developmental growth abnormality with the jaw may be longer, shorter, and we can do corrective surgery to harmonize the face, so to speak, and all the way to the more mature members of the public who may have lost some teeth or may have shrunken jaw due to aging and atrophy, and we can rebuild the jaws and the teeth using advanced technologies. Hi, I'm Dr. S.L. Chan from Aesthetic and Reconstructive Jaw Surgery here in Mount Elizabeth Medical Center.